Dr. Patel, even states with high vaccination rates overall are seeing these surges in some areas. Why is this happening?
Yeah, Alicia, it's because, simply put, we are exposing ourselves not just for the unvaccinated, but keep in mind that about 5% of the United States is also immunocompromised or has chronic conditions, and they're vulnerable even if they're vaccinated. So everybody, as we know from last year, the virus does not acknowledge any borders. Of course, we'll see these hotspots begin: Missouri, Tennessee, Texas, Florida, the other parts. But make no mistake, this is a much more infectious variant, and it is going to make the rounds across the country.
Right. Dr. Patel, sort of the follow-up obvious question there, then what are the best tools for stopping the spread?
Yeah, number 1 through 1 million, the vaccine. I mean, this is, simply put, as the world is starving for an effort to get access to any vaccine, we are a plethora of supply of vaccines. So it's vaccines. And then where we know we're not going to penetrate, Alicia, because some people just are not willing to do it, then we need to go back to layered protection. I think what LA County, Southern Nevada, and other places are looking at are important, and they're putting back indoor masks. In essence, they're punishing those of us who are vaccinated because we need these kind of blunt policies in order to keep everyone safe.
Yeah, I mean, Robinson, we have been in a state of crisis for so long that I seek solace in the charts and looking at the charts and trying to understand how the numbers today compare with the numbers, say, a year ago. So talk us through it. How does the current spike in COVID cases compare, let's say, to the peak of the pandemic?
So at this point, in terms of raw numbers, we are not seeing the kind of cases, the sheer number of cases that we saw as at the peak of the pandemic, say in December or January of last year. Of course, we're talking about percent rises still. That said, in Missouri, in Arkansas, and right now on the Florida-Georgia border, we are seeing places where the number of cases per 100,000 people, the kind of density of cases, is approaching that kind of red-hot intensity we saw across much more of the country earlier this year. So I'd say right now, we're hearing very, very dire percentage rises, which are scary, but of course they're coming from a relatively low number of cases. That said, in a couple parts of the country right now, basically it is as bad as the peak of the pandemic ever was.
Dr. Patel, 3 of the Democratic lawmakers who traveled from Texas to D.C. have tested positive for COVID, despite being vaccinated. We have all heard stories of breakthrough infections. How concerned should we be? What should we be watching for?
Yeah, Alicia, I'm very concerned, but here's why. We are not consistently monitoring breakthrough infections. The CDC is right now only monitoring breakthrough infections that result in severe hospitalizations and deaths. Absolutely, that is a priority. But we really are think about it this way. It would be like driving a car with only half a tail light and half a headlight functioning. We can't really see the fuller picture. What I will say, though, is that the fact that they were vaccinated likely saved their lives, Alicia. That meant that they stayed protected. But without monitoring, and then we're still seeing data lags. Robinson mentioned Florida. The state is about at least a week delayed in reporting data, and they're not even getting consistent data. So we are really, truly, I feel like we're flying a plane blind in some aspects.
Right, which is sort of part of what is confounding to me about that, to me, Dr. Patel, is that that's how the COVID tracking project started. It started because people didn't feel like they had enough data, and here we are, and we're still talking about holes in our data. Robinson, I do want to ask you, Florida Governor Ron DeSantis is selling anti-Fauci merchandise as COVID cases soar by almost 700% in his state. How does the continued politicization of this virus impact health outcomes? Do you have a sense of that?
Well, I mean, it absolutely is impacting health outcomes. We already see the places where vaccination is breaking through, or where the most people are unvaccinated, right, are also the part of the country most likely to listen to Governor DeSantis. It's conservative as the rural areas of the country. That's really unfortunate. Now, there is a kind of shade of good news there, which is among the oldest cohort of Americans, 65 up. The people who are most at risk from COVID, we are seeing relatively high vaccination rates, which are good even among conservative populations, which is very good. That said, you mentioned the COVID tracking project. Of course, the COVID tracking project has not been tracking data on a daily basis since March because we kind of handed over to the CDC without they were ready. Since then, a number of states, including Florida, as Dr. Patel mentioned, have kind of rolled back some of the data they're reporting. The CDC is reporting data, but we have lost some of the resolution that we had earlier this pandemic. Of course, that's because we're seeing cases kind of surge in a way we might not have expected a few months ago.